Well, hello, everybody. President Daniels, Dean Parker, Josh, Michelle. It really takes a lot to lure me away from pickleball these days. And yes, I have become that retired person who lives in Florida and wears nothing but t-shirts and flip-flops. But I was thrilled to accept this invitation to be with an institution and people whom I admire and have the utmost respect, admiration, and fondness. For some of you who have known me for a while now, you know that I am usually not someone who's at a loss for words. Quite the opposite. I'm usually exceedingly verbose, sometimes about things which I know very little. But I have to say, in preparing for this talk, I found myself struggling for what to say given the extraordinarily challenging environment we are in, yet simultaneously acknowledging and celebrating the progress we have made over the past few years, often spearheaded and supported by the very people in this room. As I reflected on this struggle, it felt entirely familiar to me. What folks who work with people in recovery and those of us who are in recovery know all too well is that recovery is not a linear process. It's not a straight line from sickness to wellness, from despair to hope, from isolation to community. Like life itself, it can be filled with extraordinary gains when you see how far you have come from where you've been, when you find beauty and gratitude in the world, when you find meaning and purpose in your life, when you feel a sense of belonging and connection to community. But there can also be very dark days when all you fear is despair and hopelessness and don't see a path ahead. When you get sick again and relapse, or when the best you can muster is to not drink and do drugs that day. When all you have to rely on is your community to hold you, to support you, and to tell you that they will carry you through these difficult times. For me, the principles and practices of recovery have always helped me not only to stay sober, but as a way of life to guide my thoughts and actions in every part of my life, particularly during difficult days. First things first, do the next right thing. You are not alone. Progress, not perfection. This too shall pass. All those slogans have served me well, and I think can be guideposts for all of us in the weeks and months ahead. While all of us understand how much work and the difficulties that lie ahead, I think we must also take time out to acknowledge and celebrate our collective achievements. After decades of year-on-year increases, overdose deaths are down dramatically over the past few years in almost every part of the country. Those reductions are driven in a large part by expanded access to treatment with medication, Medicaid coverage, and through expanded access to harm reduction services, particularly naloxone. States and local governments have received billions in additional service and research funding through federal grants and opioid settlement dollars. Policymakers finally have access to more timely and detailed overdose data. I must tell you that throughout the entirety of my career dealing with this epidemic, both at the state and the national level, the best we could do was 2-year-old data. I liken it to driving a car down a highway at 90 miles an hour, and the only thing to guide you is a rearview mirror. This shows what we can do when leadership, resources driven by evidence and data can accomplish. And I want to pause to acknowledge Dr. Ingvild Olsen, who's here with us today, who was the director for the Center of Substance Abuse Treatment, I can't say that word, Ingvild, at HHS during the Biden administration, who drove many of these changes. We owe her a debt of gratitude. All of us hope that these and other efforts would continue, but we know that this is not the case. All of the progress that we have worked so hard to achieve is in serious jeopardy. Medicaid coverage is under fire. Services and research funding is being slashed. Harm reduction, which has become a dirty word again, Funding and services are being halted at the federal and local levels. People with addiction and mental health issues and housing instability are being swept off the streets, many being subjected to cruel, ineffective, involuntary treatment. Make no mistake, all of these are outward manifestations of stigma at the policy and practice level. Perhaps most alarmingly is the wholesale abandonment and downright disdain for science, evidence, and data. This field has always undervalued science and research and has been plagued by what I call the I know a man guide to decision making, relying on anecdote rather than science and evidence. I know a guy who found recovery without medication, so let's ban medications from our program. I know a guy who got sober through his church, so let's slash treatment funding. These are not abstract concepts. These are real examples of some things I've heard from legislators and policymakers over the course of my career. So given all these threats, how might we move forward? How might we continue to try to make progress in this environment? So I have a few things I've learned over the course of my career. The first, practice harm reduction principles with politicians. Sounds kind of odd, I know. But rather than just building relationships with those who support our goals, try engaging and developing relationships with those who might not be in total sync and bring them along. One of the most surreal memories I have of my time at the White House was spending 2 days touring Kentucky with then Senator Majority Leader Mitch McConnell. No secret that there was not a lot of love between President Obama and Senator McConnell. We personally could not be more different in terms of background and politics. But ultimately, through that trip, we forged a strong relationship between our two offices, and it allowed us to move our agenda forward. So, and this is the hard part, without selling your soul, build relationships with those that may not support your work, and try to forge a strong working relationship. Next, continue to focus efforts at the state and local levels. While we might not be successful at the national level, great change happens from the ground up, and much of the action in policy and practice happens at the state and local levels. They are the learning laboratories for policy and practice innovation and can also be strong champions for change with their colleagues in other jurisdictions. And I'm sure you're going to hear some of that in the panel that's following me. They are also the proving grounds for future leadership. Clearly, one of the goals of the Bloomberg initiative is to build and shape that future leadership, but we can also work more closely and in coalition with other national organizations like ASTO, NASADAD, NACO, ASAM, and others to promote best policy and practice. Next, find unlikely allies. There are no better messengers than those from whom you would least expect it. Cultivate them, promote them. There is no better example than I can think of than Lieutenant Patrick Glynn of the Quincy, Massachusetts Police Department. As an aside, those of you who are not from New England, it's not Quincy, it's Quincy. Some of you might be aware that in 2010, the Quincy Police Department was the first police department in the country to carry and administer naloxone. And just to be clear, even though I was the state director, I had nothing to do with it. It was a Quincy mother whose son had overdosed who badgered the chief of police to carry naloxone. It's the power of advocacy. Instead of arrests, officers began to count the number of people they rescued, becoming almost a competition on who could save the most lives. Lieutenant Glynn, seeing the results at the local level, went on to become a national promoter for police departments to carry naloxone. One of our strongest voices for naloxone came not from the public health community, but from the law enforcement community. Next, just like with people, sometimes the best you can do is minimize harm. I know this can sound rather defeatist, but it's not. It's a reality given the current landscape. Sometimes, and especially during times like this, finding ways to mitigate harm might be the best that we can hope for and the most we can achieve. Many of you here today assisted in the development of best practice strategies and documents, developed principles on how to maximize additional funding flowing to state and local entities. In unfortunately similar ways, we may be forced to think how we help those same folks with guidance on how to work through budget cuts, fewer people with Medicaid coverage, and less federal support in ways that minimize harm, and at the same time preserve necessary and critical infrastructure with which to build back. Next, be the leaders you hope we would have. In the absence of federal leadership or good leadership, it is incumbent on all of you to fill that gap and to be the counter-narrative of false and misleading information. Develop and promote sound, science-based strategies. Cultivate relationships with media sources to provide good information to the public. Write not just for publication, but letters to the editor and guest essays. Be not just great scientists and researchers, but great storytellers too. Nothing changes hearts and minds like someone's personal experience or their personal story. And in the absence of belief in science and evidence, it may be our most effective weapon. And finally, be gentle with yourselves and those around you and support one another during these times. This is difficult work, even in the best of circumstances. I applaud our colleagues who have stayed in federal service, who are still trying to do some good. They deserve some special love. So as we move through what is likely some very difficult times, I urge you to commit to treating yourself and those around you with kindness and compassion and gentleness. Continue to find beauty and hope. Practice gratitude on a daily basis. Support people and organizations who are still doing good in this world. And just like we say at the end of every 12-step meeting, things can and will get better. We only have to work for them. Thank you very much.